feeling slightly dizzy because of the mixed signals that appear to be coming from the provincial health department. So just last year, for example, they raised the alarm about rising STI infections, blaming it on a generation of young people swapping condoms for pills like pre-exposure prophylaxis pills or even post-exposure. But now it seems a different tune is being sung. We're being told that, in fact, HIV infections and other STIs are actually dropping. And that's been the trend since 2020. So what on earth is going on? Are we making progress, or is it just a numbers game? But also, let's get an update, please, on that other controversial move, that proposal to offer contraceptive implants to 12-year-old girls. I'm pleased to tell you we're joined by Nichola Lutchman, who is the Assistant Director for Sexually Transmitted Infections, High Transmitted Areas, and Pre-Exposure Prophylaxis in Gauteng. Very good morning to you and welcome to our program. Thank you for your time.
Thank you. Good morning, everyone. Thanks for Bongani for having me on.
All right, let's start with the recent news. We are told, in fact, there's been a drop in HIV and STI infections. Can you explain the context of that and what contributed to that decline?
Okay, yes, thank you. And as you said, people may be feeling dizzy with our statement that we issued out. However, when it comes to STIs, more specifically, let's talk about the HIV. We've been monitoring the trends, not just from 2020, from previous years. And when we look at the trends, the HIV new infections in the country, in the province, we are seeing a decline in that. And it's due to the numerous interventions, and this is one of our interventions, you hosting us so that we get our message out there. So when it comes to the STIs, yes, we had a situation last year where we saw rising STIs within the same period. But during February, we said we rang the alarm bells. We said we need to do more as a department. We need to reach out to more people, make them aware about it to prevent STIs. And if they do have an STI, get them on treatment. And from February last year, we've been monitoring the trends through our district health information system, which guides us to actually say how many people have been screened for the STIs, whether they've been tested, and how many have been treated. And based on that data, we are seeing a slight decline, especially in your STIs like your gonorrhea or your chlamydia. However, I will admit we are not out of the woods. It's still a health challenge and poses a risk to people. And I think this is why we are here today as Gauteng Department of Health to actually make people aware that this, we have various interventions in place. When it comes to, we know STIs are predominantly spread through sexual intercourse. If you're having multiple sexual partners and not using a condom, you are predisposed to getting STIs. Yeah. So yes, we would take off our hats for the people in Gauteng to say, let us continue doing what we're doing, but let us intensify our reach as a province, as a Department of Health, to reach more people so that we see increased decline in our STIs.
Nichola, you'll appreciate the confusion if one day the numbers are up and the next actually no, they're down. I mean, one of the things you were saying last year in terms of the concerns about the STI rates rising was the increased reliance on PrEP and PEP instead of condoms. Has that concern changed?
Yes, well, in terms of that, so that was, as a program manager, that was through my engagement personally through people who were using PrEP and not through a specific research. However, we realized that from the feedback we got from PrEP users, that sometimes
so it was just anecdotal? Is that what you're saying?
Yes, that's what I'm saying. And I'm saying that, from there we decided, right, it's not just about promoting PrEP as an HIV prevention method, but we are pleading to the public, and we, in all our communications and messaging, we indicating that even though you are on PrEP, you need to still use the condom because it prevents other STIs, including unplanned pregnancies. And I think, we intensify that messaging. So, people are on board now, and they realize that it's not just PrEP. We need to use the combined prevention interventions for an individual to be protected from HIV and STIs, other STIs.
How important is clear messaging on issues like that? Can you afford mixed messages and people not quite understanding what the state of play is?
Absolutely not. We cannot afford the mixed messaging, and that is why I'm grateful for the opportunity, so that we are able to sensitize the public to say, as a Department of Health, if you are going to engage in this risky sexual behavior, if you're not going to go and seek immediate treatment, if you're not going to know your health status, I mean, these are some of the repercussions of not getting treated or getting on treatment immediately.
Yeah.
And our messaging needs to be very clear to the public to say, this is the signs, these are the symptoms, and this is where you can access our services, so that they know that, at any specific time based on their, availability. But I think, for us, we need to ensure that our community makes time for their health. It's the month of love. Let us have self-love for a change, not just this month, but always. And take care of your health. Know where to access these services.
Nichola, what age demographic are we talking about here? Who's most affected by this?
Okay, so, when it comes to the program itself, we know that our vulnerable populations remain the youth, the 15 to 24-year-olds. And like I said, it's because of numerous factors. Could be economical factors where they're engaging in transactional sex, whether it's cultural norms where it's taboo to talk about sex and get advice or get, more treatment or protection regarding, being infected, as well as what we've seen in the trends is the age group 50 years and above, also living with HIV, not coming for treatment. And within the 15 to 24-year-olds, we have intensified our campaigns throughout, where youth congregate, such as your high institutions of higher learning. We go there with a package of services. It's not just HIV prevention or treatment. It's your full PhD package of services that we're providing, including your sexual and reproductive health. And we are making sure that they have easy access to these services. In addition to that, when we look at the older age group, the 25 to 49 as well, our men remain, I apologize if I offend anyone, just to say a challenge to actually reach. And through the department's interventions, we have looked at working with numerous stakeholders, because we realize as a department we are unable to, get our HIV infections or STIs down alone. Therefore, we roped in other sectors, for example, the civil society. We're working very closely currently with Santago, the Taxi Association, to actually get our messaging across to get.
Why is that difficult, Nichola? Why is that difficult for many men in the age bracket you are describing to get this information? What makes it difficult?
I think, when it comes to men, just men accessing the healthcare services and for them to see someone is that they are ill, it impacts on their ego, if I may say. So for them, they feel, no, I'm a man, I'm strong, I cannot be sick. And sometimes they feel like, I've got no time to go and see to my health needs. I cannot go to a facility. I'll have to wait in the queue. The unfortunate part is, yes, there are a lot of people accessing our clinics. There are a lot of people standing in the queue for services. But at the end of the day, we are pleading out to men to, just have that self-love. Go and access treatment. If you're living with HIV, you have been on treatment previously, get back in treatment, get back to treatment. Go to your facility and you would receive your health care. We are also, intending on looking at establishing our men's corner, so make it more men's friendly. So that a man does come through, he may not be comfortable talking to a female, and he sees a male, you'd want to talk to a male nurse. I mean, these are some of the interventions that we have in our facility so that they can actually come through.
All right. Nichola, there was also a proposal to offer contraceptive implants to 12-year-old girls. Is that something that is still going to be implemented? Where's the department on that?
Okay, so with that one, I'm not in a position to actually provide you with an answer, but I know that our MEC through our communications department has responded on that. However, I think maybe we'll have to engage further with our youth manager in terms of, the status on that.
Is it a good idea?
I have no comment on that, but we will take it up with the managers and get back to you on that answer. Yeah.
All right, Nichola
or
Lutchman.
question. Yes.
Appreciate your time. Nichola Lutchman is the Assistant Director for Sexually Transmitted Infections and High Transmission Areas and Pre-Exposure Prophylaxis in the Gauteng Department of Health.
Current events, developing stories,
tough questions.
your voice making a difference.
This is Breakfast with Bongani Bingwa.